Hi, welcome to weststadt.podcast. This is me, Alex. I'm here as always with Jesus.
Hello, welcome everybody to this new podcast. Today we have a very special guest who is going to be joining us and giving us her opinion on these very different issues and her expertise. Please introduce yourself.
Hi everybody, I am a medical student and I am by no means claiming that I'm an expert in this field. I'm just a person who is very curious, who tries to stay as informed as she can by reading all this information, all the scientific data that is available at the moment, and not just by blindly trusting all the mass media. And I try to avoid personal bias as much as possible.
So, you mentioned to us today that you didn't want to specifically say what your name is and stuff. And you gave me some very interesting reasons why you decided to do this. I wonder if you perhaps could expand a little bit on this before we continue.
My main concern is that Corona has become such a controversial topic that most scientists who express opinions that might not be in the government line or might not represent the official opinion, which is represented by the scientists covered by the mass media, that it definitely does. They are demonized and criticized, and sometimes there's critique is much more sometimes substantial and objective, but mostly it's personal, and it also has backfired for most of them in terms of their academic or professional careers. And this is also my worry that it might somehow endanger my academic path or future career.
Yeah, so I also heard in the news that there were some YouTube videos that were taken down because they didn't apply to the official way of thinking about this. And when I see this, my first thought about this is that in some way it is a restriction of freedom of speech. And in a certain way, it's a way of shaming different opinions and of extracting them from public discourse, which I found very damaging. Could you perhaps also expand on your knowledge about this?
I certainly agree with you. And the main problem is even the UN secretary said that this crisis is the biggest human rights crisis that this world has ever seen. And this policy by YouTube, which was introduced by YouTube's CEO, is ridiculous because it just says that everything that somehow that doesn't comply with official World Health Organization recommendations, it will be treated as misinformation, it will be deleted. This is not a healthy scientific debate because obviously World Health Organization changes their recommendation every single week, and you can see it with, for example, them announcing in January saying that there is no human-to-human transmission of COVID, or let's say SARS-CoV-2, if you say the official name. Then they changed it and say there is human-to-human transmission. They, let's say, first criticized Sweden for its response. 2 days ago, World Health crisis expert said that they think Sweden is an example of how to address this extraordinary crisis situation, which means that World Health Organization regulation might change, and that's why it's ineffective and it's actually dangerous to attack our human rights and our freedom of speech by just deleting everything indifferently. Of course, there is a danger of misinformation, but also we have to rely on the citizens to be able to learn how to sort proper information from misinformation. When you just when you just delete everything that does not get covered, let's say, by the mass media, you're actually awaking more fear and awake more speculations, because then your own citizens think that the government has something to hide from us, and they're more they're more eager to consume this fake information.
Yeah, I think freedom of speech is one of the pillars you need to solve this crisis, or any crisis, to make any improvements in our lives or in the ideas we have. And it's not a recent discovery. We know this, that freedom of speech is really important. to make advancements in the culture. And it's just bad enough if you don't have freedom of speech, but even if you restrict it by ever-changing guidelines that change on a week-to-week basis, that's even worse.
And of course, if you demonize scientists that just think differently to the majority, it doesn't necessarily mean that these scientists are wrong. And we've seen it in the history again and again with cholera, for example. Jon Snow, who said straight away that's probably water transmitted by water, he was demonized. He was thought as a crazy person. At the end of the day, it has been proven that he was wrong, right. The same with people who discovered Helicobacter pylori and said that it's actually the bacteria that causes stomach ulcers. They actually had to ingest this bacteria to prove to the scientific community that this is legit the cause of the disease. And we see it again and again. It's not a healthy situation where you restrict scientists, where you demonize them for having different opinions. I'm not talking about people who spread conspiracy theories. I'm talking about scientists who just say, hey, hang on a minute, we have new data. The previous data was lacking. It was it didn't have all the information that we needed. We now have more information. We have now more knowledge, and we have to continue to rethink our strategies. And that's what a healthy science, a healthy scientific debate is. And science should not become politics, and sadly it is the case right now.
Yeah, ironically, by those who speak in favor of science are exactly the ones who actually distort science by making it a political issue.
Yeah, exactly.
Ironically,
Yeah. You even mentioned that scientists here in Germany are losing their jobs or being fired when they speak out or have other opinions.
So far, the scientists that have spoken out in Germany were either who were openly criticized some of the measures. I'm not talking about, again, extreme examples, but let's say there is this virologist from Bonn, Streeck. He, thank God, hasn't been fired, but his Heinsberg study, which is not perfect, and there's no manuscript as of today yet, but he was severely criticized for making his statement saying that he thinks this very strict lockdown wasn't necessary. Other scientists were either retired, so they had nothing to worry about, or there was a scientist who occupied a pretty senior position, and after his controversial statements, I actually Googled it, and I could see that he was replaced indefinitely. It's basically until further notice, whilst they're investigating whether they should keep him.
Wow.
And I mean, this is not freedom of speech when people lose their jobs.
Yeah.
That's very well put. Yeah.
Well, yes. To go to another point, we already touched on it as how serious really is this coronavirus, and we see from the beginning, January people were saying, "Oh, this is not a problem. We don't have to worry about," and they were downplaying it. Then suddenly it became a really huge issue, and all the countries had to shut down, close their borders, close their schools. And but I guess right now we have more data to really know how serious really is this coronavirus, how deadly. I think you have read a lot about this.
So I guess here we should start by saying that initial models that were built by, let's say, Imperial College, one of the most influential models, predicted that there will be at least 2 million deaths from the virus, even if you impose a very strict lockdown. The reason why it was so apocalyptic was because it was based on the Italian scenario. The reason why Corona escalated so much in Italy is a multidimensional problem. First of all, they have an aging population. Second of all, they have the highest rate of antibiotic resistance and nosocomial infections, nosocomial being the infections which were acquired in a hospital. And that's also one of the things that most of the scientists are concerned about, that perhaps a big proportion of the patients in the ICUs don't actually die from corona itself, but also acquire secondary infections, bacterial infections, and develop sepsis, not due to corona, but perhaps. It's not researched at the moment still. But Also, Italy has only 10,000 ICU beds, whereas Germany has more than 40,000. And Italy is the country where the most common household type is a 3-generation household, where elderly people live together with small children and their children, which means the infection rate and also the transmissibility is much higher than, let's say, in Sweden, where seniors mostly live alone or separately from their children and from their grandchildren. And of course, it also highlights again the point that corona is definitely not a dangerous virus when you have a healthcare system which is not overwhelmed. And that was the initial message about the whole all the measures that will have to flatten the curve. And I guess the most representative study in terms of corona mortality could be the Princess Diamond case study. It was a ship which was quarantined near the Japanese shores for 2 weeks, where due to the fact that it created the perfect environment for the virus to spread, as it was a limited amount of space, a big group of people, albeit people were, most tourists on the ship were above the age of 60, which means that most tourists on the ship were actually in the risk group. And even there, where the majority of infected people were in the risk group, the mortality rate ended up being 1%. Of course, with in a situation where a healthcare system was not overwhelmed, which we can use as an example to see that it's actually probably not a dangerous virus, or most likely not a dangerous virus for the majority of the population. And also the apparent differences between Western Europe and Eastern Europe, the reason why the mortality rates are so different, it's also something that most scientists are finding perplexing, and what we need to research further, because it definitely does not have a lot to do with the quarantine measures, as all these countries adapted different quarantine measures, and it's not the case that, let's say, Eastern Europe has adapted more stricter measures compared to Western Europe, but rather it must be something else that has to do with the fact that the mortality rate and the situation is much better in Eastern Europe.
Yeah, so what you implicitly mentioned there is basically that it was a study that was really good because it looked at older people. And we have always heard that the older people are the ones who are actually at risk of dying from the virus or of having severe symptoms from the virus. But also many people have also said, well, but I mean, young people are also dying, right? So I know that the Tagesschau, I think that a couple of weeks ago or 1 week ago, it showed, different pictures of young people who basically saying, yeah, I'm also at risk, and, young people are also dying. So they would sort of present this as if it was also a serious apparent risk for people who are young. So my question to you would be, how would you evaluate that? Are young people really at risk, or would you differentiate between young people and old people?
What mass media tends to do, it tends to take anecdotal evidence. So anecdotal meaning it's individual cases, and generalize it to the whole population. Of course, every single rule has, there are exceptions to every single rule, and there are young people dying from other diseases that they're not supposed to be dying. But the majority of cases, for example, most of these stories actually are coming from America, but even American doctors are saying that most young people who died in America were severely overweight. Overweight meaning they're probably having hypertension and they're having diabetes, all of these conditions that are contributing to the risk factors and contributing to the risk of actually developing a severe COVID-19 disease. At the same time, one has to say that there are also some cases where young people with no predispositioning conditions were dying, but there most people agree, most scientists in the scientific community agree that it probably has to do with the viral load. So let's say if they were in a situation where they inhaled a lot of the virus at one given time, it might be the case that they will develop a more severe condition than most of us will, because if we get infected, we will probably get infected in the community and we won't get the chance to actually inhale a significant amount of the virus.
Yeah. The other thing we hear a lot about is, well, yes, this virus is serious, but what's even more what's even worse is that it could mutate and it could become deadlier, and then everything would be a chaos. So that's why we need all these measures. What do you know about that?
Leading virologists are similar in their opinion, that they say that if it will mutate, it will most likely become less deadly, because it's evolutionary advantageous for the virus to become less deadly, as when it kills its host, it cannot spread properly. Whereas what we can expect with COVID-19, or let's say SARS-CoV-2 virus, is that it will over time mutate, become less deadly, and will come and will reintroduce itself again and again in our community in the form of common cold virus. What already happens with other coronaviruses that circulate every year, and let's say flu viruses and adenoviruses.
Okay, so from what we have been discussing until now, we have been discussing sort of how serious this coronavirus is. We have seen how the statistics that were used at the beginning were based on the case of Italy, which, as you explained, correct me if I'm saying something wrong, was not necessarily representative of the actual numbers that go in hand with the disease. We have seen other studies that seem to be better and more representative. And now that we have sort of looked at this in general, my question to you would be, as a general question, could there have been another way? Right? So could we have solved this crisis or made other measures that would perhaps have been more effective? So one of the measures or one of the proposals that I have heard a lot, and that also has been discussed in public media, in the Tiger Show was also discussed, was the idea that if there is a group that has a high risk and there's another group that does not have as high as a risk, like young people with no pre-existing conditions, why then should we simply impose special restrictions or give special care to those who are really in danger, but not on the ones who are young and healthy individuals? What do you think about the proposal of separating these two groups or treating them differently when challenging this corona crisis?
So, of course, now we have the benefit and the hindsight, and we can look back and see what we did wrong. And a lot of countries come to the conclusion that even though it does sound a bit, let's say, demeaning in some way, but it would have made more sense to actually protect the most vulnerable, so people in care homes. Instead of shutting down the entire economy, what we should have done is actually isolate the care homes, shut them down, forbid the visitors, and also ask the nurses and all the personnel working in the houses to, let's say, stay there permanently for 4 weeks. Of course, not unpaid. They should have gotten benefits. They should have gotten a much bigger salary than they normally get, because obviously they are then on the front line of such an extraordinary situation. But if we could have contained it within the space of care homes, we could have allowed it to spread within the community, not having to worry about a high mortality rate, not having to worry about the overwhelmed healthcare services. Of course, we have a big proportion of all the people living outside of community of care homes, but we still see that the biggest problem, and let's say we can use Sweden or UK as an example. Like in the UK, only in healthcare, so in care homes, 7,000 people died since the beginning of the outbreak, and maybe even more. In Sweden, out of a bit more than 2,000 people who died, the majority of the cases were in care homes. It was people who didn't have a high life expectancy. There's such a term in statistics in epidemiology, it's called years lost to disease. So even with corona, we actually don't see a lot of years lost to disease, because the people who died already had a really low life expectancy, but it still shows that there could have been a better way to protect them. And now we do realize our mistake, and we can learn it from the future. In terms of shutting down schools, which most countries done, again, we have to say, Sweden and South Korea took a risk back in the day. Now we have more data. There's this really great study on Lancet. It's a meta-analysis of the impact of closed schools in Asia. And this study showed that shutting schools could contributed to slowing down the spread of the virus only by 2%, whereas the negative aspects of shut schools, both socioeconomic aspects, the fact that children were left without education, the fact that most people forget that most children do not actually, we are the privileged few that have access to computers, whereas most children do not have access to computers. Furthermore, some children are living in abusive households where they before had an opportunity to use their teachers as their trusted people and have some sort of social protection from their teachers and from their households. And all of these impacts are now becoming apparent. And this data shows that actually children do not, whilst they can get infected, they do not show the symptoms. And even immunocompromised children do not get severely ill, according to the recent statement by NICE, which is NICE is an English healthcare facility which issues guidelines for all the practicing doctors, which also means that countries like Switzerland, for example, have allowed kids below the age of 10 to see their grandparents and hug their grandparents, because the more data that we have, the more data shows that children are not endangering the speedy virus transmitters, which is normally the case, let's say, with flu.
Yeah, I just wanted one more thing before Alex can ask you the next question. You mentioned very, very briefly the concept of years lost to disease. And I think that's very interesting, because the normal way in which this is presented is simply how many people died. But it seems like from this concept that you're using of years lost to disease, you're differentiating, right, between dying at different points in time, which I think is very reasonable. Why do you think this is not being talked about? I mean, this is the first time that I have been heard about that.
I think it's the problem is because as soon as you use this concept, which is a valid epidemiological concept, people start blaming you for not being empathetic. But it is not the issue of empathy, because of course we have to be empathetic. Of course, we as doctors, or we as people, you don't have to be a doctor to feel sorry for a life lost, to feel sad and depressed about someone dying. But if you're talking about population, and if you're talking about measures which apply to the entire population, you unfortunately do have to make some very uncomfortable decisions. Mm-hmm. You have to make some controversial decisions. You have to think about the broader risk for the population. And that's why you apply this concept of years lost to disease. That's how actually people who, let's say, are responsible for the finance part of the healthcare decide whether if you are living in a welfare state like Germany, whether it is worth for the government to sponsor a certain medication or sponsor a certain treatment. So they look at the benefits of every single treatment and see whether this, let's say there is a certain disease, and because of this disease, people's life expectancy decreases. And you have to see by how much does it decrease, and this is called years lost to disease. Mm-hmm. And whether it's worth to, let's say, sponsor a specific drug which will increase their life expectancy.
Okay. So we already use it. So it's nothing new. We already use it all the time.
We use it all the time. We use it to allocate, let's say, government resources for healthcare.
Yeah, and well, I think what this also says is that we don't live in a one-dimensional world where you only can die of one disease. No, that's not the case. You can die of many things. And so it doesn't make sense to only see one disease, coronavirus, and expect people only to die from this, but you have to see the whole picture. And okay, maybe we save lives from coronavirus, but that may have unintended consequences where we lose more lives on another end. And I can expect more depressions or suicides rates.
This is, for example, already happening with all oncological patients. So all people have cancer. Their treatment have been postponed indefinitely, whereas there are also all the other elective treatments that have been postponed. The main issues being, let's say, with abortion. You only have a certain time in which you can abort a child.
Yeah.
It's also a controversial topic, but if you're saying about the woman's like a free right to decide, you are taking away this free right to decide when, because a month later she might not be able to abort anymore. Well, whereas with like cancer patients, their treatment is day sensitive. It's not just month sensitive or year sensitive. The longer they don't receive their treatment, the higher the chances that they will die. And a lot of people have to be operated immediately. They have to get chemotherapy immediately. It's not that they can wait for 2 months or 3 months.
Or 2 years.
Or 2 years, until the vaccine comes around.
Yeah, and we mentioned this on the last episode, and I just want to comment this. Like, these people, they also paid for the healthcare system, and they have a right to use it. And now take that right away is also very unfair because they paid for it.
And also, there is a really good statistic for every 1% of unemployment. You have to expect 1% of increase of suicides. You have to expect 1.7% more heart attacks. And especially right now, we see a spike of people dying from heart attacks and strokes because so many people were scared off from going to hospital because they think hospital has to stay empty for COVID-19 patients. Second of all, it could also be purely to this emotional distress that they're facing at the moment, because most people, we don't see the end of the tunnel. No one knows when this will end. People are losing their job. People, especially people who were supposed to go into retirement. Their retirement is going to probably the money that they're being paid by the government is probably going to be cut. The youngest people who are just about to graduate from universities and go to labor markets, they also have no jobs. So we'll definitely see a much greater number of people having some mental disease. And there's such concept in medicine, which is a proven thing. It's called psychosomatic medicine. It's basically when your emotional distress get transferred into proper physical problems, which have like a proper pathophysiology. Let's say that your health condition decreases. Not decreases. It becomes worse.
Yeah, I think if you really, no, I think it's irresponsible to put such a big of a measure like the ones we have, and to justify it on the benefits. So no, we want to save lives from coronavirus, and not seeing the effects or the unintended effects it has. That's irresponsible in my view. And if you spend that amount of resources and destroy so many, or at the very least take so much freedom from people.
I think the problem is also what most politicians face is that I don't think they're idiots. I think they understand the long-term impact of all these measures. But of course, people tend to believe on the short-term impact. So the argument is we're going to save a couple of lives here. I'm just simplifying it a bit, of course. And I'm not trying to be like cynical. So I'm just stating things as it is. And none of the politicians want to stay in history as a person who killed everyone's grandparents. Even though in long term it will be we will not remember them as people who caused financial depression, who caused a spike of suicides, a spike of other healthcare conditions, because this will be spread out over the course of the next 10-20 years.
But I think we should look for that, for the other consequences these measures had, and also hold them responsible for it. Now to continue. At the beginning, the initial message we heard when the lockdowns began was that we have to flatten the curve, so that the healthcare systems don't be overwhelmed. But we will use this time to expand the capacities and then be prepared when the real
spike
wave comes with corona issues. And but right now the message seems to have shifted. Right now they want to maybe open a little bit the lockdown, but we are waiting for the vaccine to be developed and mass produced. What do you think about that?
That's we think one of the biggest issues, because in the time that the lockdown has been enforced, so it's almost 2 months now, at least in Germany, we actually did have the time to expand the healthcare facilities. We have a lot of free ICU beds. So far, the last 2 months, the healthcare system has been underwhelmed, actually. A lot of hospitals have sent their workers home. They were receiving benefits from the government because they didn't have work to do. Whereas right now, the message about the vaccine, which is being spread by most politicians, also false, because it's not given that there will be a vaccine. Vaccines are great things, and if they're tested properly, they've saved a lot of lives. But vaccine development normally takes at least 5 years. Okay, of course, there is government officials saying, let's speed up the vaccine regulation process. Let's just make sure that we have a vaccine. Who cares if it's not tested properly? However, this is the most dangerous way of thought that you can adopt, because for most part of the population, the threat from this virus is negligible. Of course, we don't know the long-term impact yet, but the short-term, people seem to get over this reaction, and they don't, at the moment, seem to have any long-term damage. Whereas from a properly tested vaccine, people can develop autoimmune diseases, people can develop adverse reactions, they could develop extremely overshooting immune responses, or they could even die, which was the case with the first polio vaccine trial, where 9 out of 10 children died from the vaccine and not from the disease, which is...
That's horrible.
Yeah. Something that a lot of politicians tend to forget, and a lot of scientists who say that are being then demonized, saying that they are spreading the wrong message. But it's not going. We tried to develop a vaccine for flu, and yet it's only about 40 to 60% effective when we get the mutation right. When the mutation is wrong, then something like 2017 flu epidemic happens, where a lot of people get ill because the vaccine is not effective.
Well, that's something you don't hear. You hear the vaccine will be ready in 1 year, and it will work perfectly. Or that's
no one knows that, because not even Bill Gates or the best scientists in the world can tell you whether there will be a corona vaccine.
Yeah, and I think this way of thinking, like, we need to speed it up, is strange, right? As if, I don't know, we were making an assembly line, and you just sort of put more people in and just speed up the way in which the assembly moves, right? No, I mean, this is not something you just speed up, right? It's a difficult process of finding things out. You don't know when it's going to be found out. Perhaps never, right?
And so also the issue, let's say, a lot of people who develop severe COVID-19 disease, it is thought that it's potentially due to immune over-response that is called cytokine storm. And vaccines are programmed in a way to promote immune response. So if we need to research it further, but if we find out, let's say, that most people people who get severely ill get ill not because of the virus itself, but rather from this overshooting immune response, maybe by administering vaccine, which speeds up this overshooting immune response, it will be actually counterproductive. And you don't want to, let's say, drive a car which has not been tested properly. You don't want to drive a car without brakes.
Yeah.
So.
Yeah, no, I don't want to do that now.
Yeah, or at the very least, you can have it as an option that may be available in 1 year, but it's not certain, and it's not the only one.
Of course, it's something we shouldn't just rely on a vaccine. We should adopt, we should change our thinking and try to find new, more creative solutions to this unique problem.
Yeah, but it's strange that it's presented like the savior, the hero, the vaccine coming in 1 year.
So another measure that has been talked around, I find it's very interesting. This measure was about wearing masks in supermarkets, shop, and public transports and shops. And the idea is this is going to prevent the virus from spreading. I also find it very interesting the way in which it's presented. Right? It's presented as if you have a responsibility toward your fellow man and to yourself. it's not to protect you, it's to protect others, right? And we have to, stand together and wear these masks. But I've also heard, critics saying that these masks aren't that effective. So I would ask you, from the papers that you have read, from your knowledge, do you think these masks are effective at preventing the spread of the virus?
So World Health Organization guidelines, as well as guidelines issued by public health officials in Sweden, let's say in the UK, say that after analyzing all the available data, they say that masks should be reserved to the healthcare professionals and also people who are symptomatic. For asymptomatic people, there are absolutely no studies that were performed in a community setting. There are a small amount of studies that were performed in a clinical setting, and even in a clinical setting, the results are quite non-optimistic, because they show that in the best case scenario, let's say if we use flu as an example, because there are no studies that cover COVID-19 disease or SARS-2 virus, they show that the maximum spread you can slow down the spread of the virus, or you can decrease the spread of the virus in the clinical setting by 6%, which is almost on the borderline with being statistically insignificant. And a lot of politicians try to advocate this measure by saying it's not the lack of evidence, it's evidence of lack, that they're using precautionary measure, that they're doing something that could potentially help. However, they do not take into account the dangerous aspects of this measure, the fact that most people are incapable of disposing of masks properly, of actually applying proper hygiene measures when they use it in the community, because first of all, we don't have proper bins where we throw it away, because mask is, after being worn by a person, mask is just completely, it absorbs all the possible pathogens, the viruses, bacteria and fungi that this person had in their mouth or on their skin around their mouth. Which means that mask A could potentially become transmitters of the virus themselves, because most people just throw them away in a normal bin, or don't even throw them away, they just put it in their pocket. Of course, forget to wash their hands and then touch everything, which means their hands are contaminated with the virus. Second of all, a big aspect is self-contamination. Masks, above all community masks, this do-it-yourself mask, they create perfect, warm, humid conditions, which one study has shown 7 minutes is enough to increase the amount of bacteria and fungi present on your skin by 80%, and that was in the clinical setting using a surgical mask. So if you're using a cloth mask, this number might have been much bigger, which means this potentially pathogenic, which are opportunistic bacteria, which normally on your skin are not dangerous as long as they're outside your body, but if you're wearing a mask, it means that you could potentially inhale them and actually contaminate yourself and get ill because of staphylococcus or some other fungi spores, which is also something that's almost ignored by all the politicians. So, and third of all, the point which a week ago I thought wasn't probably the main point of concern, but now I see, from anecdotal evidence, of course, when I go shopping, when I go somewhere, I see that people who wear masks, they just immediately assume they're invincible, which is not the case, because there's nothing better than washing your hands and just keeping the distance, and they forget to keep the distance, and they forget the fact that masks might potentially prevent you from spreading your microbes to other person, and distance is something that actually does it, and actually does prevent you from doing it.
Yeah, I don't know about you, Alex, but I have almost an university degree, and I'm pretty sure I don't use the mask properly. So that makes me very skeptical.
I use the mask properly when I work in a hospital in my part-time job, but even I personally, and I know all of my friends who also work in the hospital, say that in the community, when I go shopping, it's impossible to use it properly, because as soon as I leave the shop and I want to take it off, I don't know where to throw it away. I don't know where I can wash my hands. And I don't know how, of course, I don't have an indefinite supply of masks, so I also have to be wary and have to wear the same mask for multiple times. And if I'm wearing the cloth mask, I'm not able to use the washing machine for one mask every single day, because frankly, and trying to be savvy with water and electricity, and I can't just use washing machine 24/7. Yeah. And I think that applies to all people.
Yeah, again, it's not that people are stupid and incapable of using them. No, it's just that it's impossible in these conditions.
And also it's because you really have to get yourself like trained not to touch the mask, let's say, whilst you're wearing it, which all the people are doing. And also you can't just, let's say you have a smoke, take it off, smoke, and then put it back on.
Oh, yeah. I see that every time I go to the supermarket. Yeah.
Because if you do that, you have to use a new mask because you contaminated your hands and you contaminated the mask. So, and that's the problem. It's just impossible to do that.
So it's a fairy tale. That's a fairy tale.
Again, we see a measure justified on the unknown potential benefits it might bring, without considering all the unintended or just the other consequences if you use it improperly, or even the costs this brings. How costly is it to produce that many masks? And I don't know if it's true, but I would guess that, as you said, you need these masks in the hospitals. The doctors need it.
Of course, the respirators, which are the only effective type of, let's say, proven type of protection. Of course, they have to be reserved to the medical personnel and probably people who are actually at risk of getting the virus, because it's the only type of protection which can actually provide you protection from the virus. Just not only not spread it, but also not get it from other people. And that's what I think is like a more sensible idea, to sell people who are immunocompromised, people who have diabetes, to actually get prescriptions, let's say, and that for them to be able to buy these kind of respirators in the like in pharmacy stores, let's say. Whereas for us, it's just really a pure waste of time, which also could be quite an unhygienic measure, which could potentially cause more problem than it actually solves.
Yeah, I think we're getting to the end of this episode, and then I would say we give our conclusions.
So to conclude, I think that one point that you stressed a lot was the point of scientific freedom, right? Of not demonizing other scientists, of letting them cooperate. What would be your concluding message when it comes to that? What would you advise people? What attitude should people take when discussing these issues?
I think, first of all, flow of ideas and freedom of speech is very important, because only when you have a lot of people from all different fields cooperating and trying to come up with a solution, you can come up with a solution that will address most of the issues. Of course, you will never have one fits all approach, but you have to be ready to make compromise in such a difficult situation. Also, I guess what's important, we have to learn how to be proactive and not reactive, and for the future, especially taking into account that we will be facing other pandemics in the future, we have to do something before the crisis hits. And also, we shouldn't blame anyone or find scapegoats like, let's say, Trump is doing with saying the Chinese virus, saying who's, of course, everyone is a bit to blame for the escalation of the virus, because obviously we just don't have enough knowledge to be able to address it perfectly straight away. But we can learn from our mistakes and we can improve. And I think it's important, and I think you guys will agree with me, is that people tend to oversimplify this issue and say, okay, it's the question of economy versus healthcare, which is not the case, because if you forget about the economy, say, okay, whatever, screw the economy, you then have a greater risk of, like, a greater rate of poverty, and a greater rate of poverty leads to more disease, leads to worse, underfunded, let's say, healthcare system, which means that this healthcare system can be less effective in taking care of the patients, and not just corona patients, but everyone.
Yeah, no, from my economic understanding, and here I would refer you to the last episode that we made, which was about especially these effects of the measures taken by the government, the corona crisis, on the economic effect that this has. And just to simply, brief it together, it's really bad, right? So the finance minister of Germany already stated that they predict that GDP is going to fall by 7.4%, I think was the statistics. So I would just simply say, it's inseparable health and economics. It's not one versus the other. If there is no economic activity, if you don't produce, if you don't have hospitals, what are you talking about health? This is a consequence of the fact that we produce. So you cannot have one without the other. And it's exactly because we have such economic advantage and we're so rich in the Western world that we can even have these discussions and take all of these measures. So to pretend as if people are evil because they care about the economic impact is absurd, right? If you care about people, if you care about life, then you should be primarily concerned. It should be a very important issue to think about economics because they are the tools that allow you to actually save people's lives. So I think it's irresponsible to present this as if it was health versus economics. No, it's economics, and through economics and through our work, through the resources, we can also have very wonderful health impacts and try to actually protect people from COVID-19.
Yeah, and this was something we had mentioned before recording the podcast, and it is that right now we need to be very flexible on the strategies we are using, and it's precisely because we don't have the we don't have all the information we need to make the perfect decisions. So we need to wait until the data comes and then react to that data and see what strategies we implement. But for that, we need freedom of speech so that we know, okay, what's the whole spectrum of the different strategies we can use, at what cost comes each of them, and which are more effective, which are less. And then okay, we try one strategy, maybe for a week, 2 weeks, see until the data comes, and then we see if we want to change it or not. And the only way to do that is to really have a discussion about all the different strategies and the costs. And maybe you see a strategy that's perfect for you, but maybe someone else discovers some flaws or some unintended consequences of these. And you just need to have that discussion. And also, I know I find it on a personal note quite strange to just shut people down. I imagine you would do that on a discussion you would have with a friend, or like this, like you don't agree with what I'm saying right now, and I just say, yeah, shut up, or I take your microphone away. That's not a way.
And I lock you up in your house.
yeah, that's not a way you would ever react to your friends, to your colleagues. But why would it be okay the government reacting that way? And it's also a defeat for yourself, because if you know you're right, if you have reason on your side, if you have the facts, then you're okay with anyone saying just stupid things, because you can very properly explain to anyone who uses his mind that this other person is wrong, and you can explain to him all the logical steps you need to take to get to the conclusion you have. But if you just shut them down, if you say, no, you can't even talk to them, that's a defeat for you. You're saying either you're not capable of proving the wrong, or you're saying all the people are stupid and nobody is able to use reason, so I have to forbid them to listen to other opinions which might seem persuasive.
Yeah, so I don't know if you would like to make your final comment or conclusion, or to wrap up what you think people should take away from the discussion we have been having all day.
I think it's just to always stay critical and try to actually avoid forming an opinion too soon, and try to actually get the information from as many sources as possible, and not just read, let's say, one, like Tagesschau or ZDF, and think, okay, I know everything, and just always be critical and ask what is necessary, what is not necessary, and always try to make it yourself clear that it's never ever so simple. It's not black and white. It's 50 shades of grey.
Yeah, would like to say something else?
Yes, well, to keep the discussion going, we will put our email address in the show notes, and you can give us feedback if you have different opinions, if you have different evidence. We'd like to hear from you. And we will also post resources we gathered, or that our guests gathered, for this show. So that's for today, and we hope to see you next week.
Thanks you a lot for listening. See you next time.